Obstructive sleep apnea is a very common and highly prevalent condition. It affects about 47 million adults in the United States. When they fall asleep, the throat falls asleep as well, just like the soft rubber tube of a bicycle or a tire of a car, and it goes flat. CPAP is a continuous positive airway pressure device. It applies positive pressure to keep the throat splinted open so that the throat doesn't obstruct or snore and disturb sleep at night. In 250,000 people, who are a representative sample, we believe, we found that only 43% of them were actually using CPAP like they're supposed to. Even though we diagnosed them, we're not doing a good job of treating them because we're not able to get them to adhere. It's not as easy as popping a pill. It is requiring a behavioral change, and it's a complex device that I need to know how to operate, how to turn it on, how to clean it, how to take care of it. I've had patients ask me, have you ever worn the CPAP mask and slept at night? And I had to say, I confess, I do not use a CPAP machine at home. What we realized is that we need to find a solution that is patient-developed, patient-driven, that we can implement in the real world and test it out. Our study was focused on CPAP adherence. We need to help improve their health literacy and help them connect the dots. And what we did in the study was in about 263 patients, we randomized people to get a peer buddy. They can be advised and educated by their peer buddy. One in-person visit, they show them how the mask is put on, how to use a mirror, how to fill the water in the humidifier, how to take the machine apart and put it back together to clean it. And then the second time around, the patient did that so that they can demonstrate that they had learned. The rest of the interactions were all over the phone. So the first 3 months is the intensive time period where there were 2 in-person visits and about 8 phone visits. And then the rest of the 3 months, it was more like a lifeline. They could actually reach out to them and ask for help. And the care coordination was done for them to be able to reach their provider, be it a sleep technician or doctor or nurse. But we found that about 90% of the interactions happened with the peer buddy. The group that got the peer buddy, that got the patient who was being their personal coach, their adherence was actually about 45 minutes greater per night usage. And that may not seem like a lot, but if you flip it around and say that's 45 minutes worth of low oxygen count that someone suffers, that's pretty stressful. What we're doing here is not just scalable. Can we get people with diabetes to be more adherent to their treatment? Can we get people with high cholesterol to be more adherent to the treatment? And can we get patients with heart failure to be more adherent with their treatment? This is not just scalable, but it's also exportable to other chronic medical conditions, and we think we have the magic recipe.